With everything else going on, the nation's crank health secretary just made significant changes to the childhood vaccine schedule. The number of routine shots recommended by the Centers for Disease Control and Prevention was reduced from 17 down to 11. The prior schedule, agreed upon by experts using decades of medical science and research, served as the basis for statewide vaccine regulations. The changes will now lead to reduced immunization rates for diseases. Among the shots no longer recommended after birth are hepatitis B, hepatitis A, RSV, rotavirus, HPV, and meningococcal. The alterations were made with no apparent evidence provided beyond the Secretary's own ideological and economic commitments to vaccine skepticism. The Department of Health and Human Services released a fact sheet explaining the basis for the vaccine changes. Under the section titled Scientific Review, there were 4 bullet points. The first noted that the U.S. recommends more vaccines than other peer nations, which is not an actual scientific review of vaccines. The second noted that other countries without certain mandates had high immunization rates, which is also not an actual scientific review of the vaccines. The third point was about declining trust in U.S. public health, also not a scientific review of vaccines. And the final bullet point was simply a call for studies to be undertaken on vaccines, studies that have already been conducted proving that they're safe and effective. President of the American Academy of Pediatrics, Dr. Andrew Racine, said in a statement, quote, "Today's announcement by federal health officials to arbitrarily stop recommending numerous routine childhood immunizations is dangerous and unnecessary. At a time when parents, pediatricians, and the public are looking for clear guidance and accurate information, this ill-considered decision will sow further chaos and confusion and erode confidence in immunizations. This is no way to make our country healthier." Robert Kennedy Jr. is about to begin his second year overseeing public health. His first year on the job was catastrophic. The number of measles cases in the U.S. topped 2,000 for the first time since 1992, back before the MMR vaccine was made available and recommended to children. At this rate, the U.S. could lose its measles eradication status as soon as this year. Hey, thanks for watching. Hit the subscribe button so you don't miss any of our new videos. Also, if you want to see Means Morning News in its complete form, not just the clips we post here, head on over to Means TV and get access to all our new episodes and our entire backlog, plus tons of other great movies and original TV shows.